Loka Palugo. I'm hosting a wonderful topic today on the life-saving benefits of cancer screening. Today we are being, the talk is being held by Dr. Ibifunke Pegba-Otemolu, which I hopefully pronounced well. I tried my best. Oh, she's shaking her head. I'm sorry. But yes, sorry, I haven't had time to introduce ourselves beforehand, but I'm sure that you'll be able to do a wonderful effort of introducing yourself.
Thank you very much. So my name is Ibifunke Pegba-Otemolu. I'm a general surgery registrar. That means that I am in training to become a consultant in general surgery. Specialty remains to be declared. Thank you to CAHN for having me again. It's always really wonderful to be able to speak on this platform, as I'm very passionate about getting us to all advocate for our own health. I have prepared a talk today on cancer screening, and I would first of all like to say thank you to everyone who has joined, because I know we're well past the time that we expected, and you've taken the time to still be here. Unfortunately, I can't share my screen just now, so I will just talk through the information. And I think sometimes I enjoy that a bit more because it means you don't have to stare at a screen and we can just have a conversation about the things that we're talking about. So I thought we would talk about why cancer screening is important, why are we having this conversation at all? And then think about the ways we should be talking about cancer screening and things that we can be doing going forward to, individually and as a community. So what is screening? Any screening, cancer screening, non-cancer screening, what is it? What happens with screening is there's a problem. There has to be a problem that can be solved. So we don't screen conditions that we don't have treatments for or we can't prevent the progression of. We screen conditions that we know we can do something about. You can implement treatment early and that treatment will make a difference. With cancer screening, we also have to think about conditions where the screening is affordable. So it's not going to drain all the financial resources from the system that is financing that screening. Because healthcare, someone always pays. If you don't pay out of your pocket, somebody else has paid, whether that's an NGO, the government, somebody is paying for that healthcare. So those are things to think about. That screening program must be affordable for the system that is financing it. The individuals that are being screened must be at risk. So, for example, you wouldn't screen for prostate cancer in women or screen for cervical cancer in people who don't have a cervix. So, the people being screened have to be at risk. So that investigation brings about an answer. Does this person have a risk of this condition? And if they do, what action do we need to take? So that's screening in a nutshell, what it is and how it comes about. And what this means is that if there are conditions that can progress and that can cause problems, but if a significant number of the population is not going to be affected, then that means that that condition will not be screened for, not because it's not important, not because it doesn't cause problems, but because financially the math doesn't add up. And that's going to become important as we go down the line and we talk about prostate cancer, for example. So what's being achieved in the UK? Lots of people are being screened. Over 2.7 million people are reported by gov.uk to have been screened for bowel cancer. 2.2 million women have been found to have abnormalities of breast tissue through the screening program. I think what's the number for cervical screening? It's cervical cancer screening. 3.4 million women have been screened for cervical cancer, cervical abnormalities. And onto that, from there, the number of people with cervical cancer detected through screening. So these are really, really large numbers. There's a lot of work that's being done to help people. But why is this important to us? Why as the Caribbean and African Health Network in the UK, should we be talking about this? There's a problem. We don't know why, and this is an area of research that lots of funding is being poured into. Why are there inequalities in cancer care delivery when it comes from the roots to diagnosis? So people from Black and ethnic minority groups are more likely to be diagnosed with cancer in an emergency setting rather than through the screening program. People from Black and ethnic minority groups are more likely to experience treatment in a way that they don't enjoy in comparison to other ethnicities. The outcome of treatment, people are more likely to have advanced cancers at the time of diagnosis, the treatment, death from the cancer diagnosis. And these are things that potentially we can influence from our engagement with the screening programs, because there's the potential problem may be that we don't attend screening. So these are some of the issues that are happening that we think might be why. And there's lots and lots of research, lots of people are spending time and money trying to understand what's happening and what's driving these problems. So that's why, as a community, and especially as we're learning to advocate for our own selves, we're having these discussions about screening. So the benefits is screening harmless, because people would be like, oh, I'm scared of this, I'm scared of that. Should I go? So benefits, we'll talk about some of the benefits. With screening programs, because you're able to capture problems, for example, something called a polyp. So if you go for a colonoscopy is a camera test that allows you to put your it allows you to have your large bowel inspected to see if there are any problems that we can treat. So a polyp is a very tiny growth, let's call it a growth, that comes from the lining of the bowel. And that growth sometimes can become a cancer. But if you can pick that growth up early and take it away early enough, then you can stop that progression into a cancer. So these are some of the issues that you can address with screening. And what you do when you attend screening is you reduce the total number of people who are presenting with cancer, because you've caught those polyps early, you've taken them away. And similarly with breast cancer, there are precancerous lesions that can be taken away. The same thing with cervical cancer, there are precancerous lesions that can be taken away. So we reduce the number of people who get cancer at all. And then the cancers, when they're found, they're identified early. Most of the cancers cause problems when they spread. That's when they kill. It's when they go to the lungs, the liver, the brain. That's when they cause problems. But through screening programs, you have the potential to catch them before they go to other parts of the body and cause problems. There's reduced ill health when people actually have diagnosis of cancer through the screening program rather than when they're ill and they're brought to hospital. And because we're able to do all these things earlier, we reduce the chance of people dying from cancer. So what are the harms? How can screening cause harm? So things like overdiagnosis and overtreatment, those are problems for person who's financing the screening, as well as for you, the patient, because you were fine until you went for a screening program and somebody told you that you had some cancer or precancerous lesion and everything was fine. Now you have all kinds of anxieties about, is this spreading? Am I going to die? How does this affect my family? That creates problems for you.
Dr. Ibi,
Sometimes you're told you have.
Doctor, sorry to interrupt you. I've just been told by Ruth that you can share your slides now.
Okay, I have two accounts, so it needs to be the other one for me to be able to share.
Oh,
So I
okay.
haven't shared
Right.
it yet. Thank you.
Sorry. Sorry to interrupt. Carry on.
No worries. Thank you. So if the other one can be activated as well, then I can do it. Coming back to the harms, some people get false positive results, and the more dangerous one is when people get false negatives. So you're falsely reassured that you haven't got cancer, and it turns out that you have got cancer. Um, Sometimes the physical and psychological impacts of all of this can be quite stressful. But on balance, if we weigh all these things and we think about it, if you were the person whose life was saved because cancer was detected early, then all these other harms of screening, they pale in comparison. So for the person who didn't have cancer and had the stress, yes, it's a lot. But for the person who did have cancer, then it's a bit, you see that the benefit is quite important. Okay?
Hello. He wants to join in.
Yes, it does. No.
What do I watch? Fishing?
BBC.
No, I only watch PJ Masks. No, I only watch PJ Masks.
Excuse me.
He wants to join in and make some good points, I think.
Thank you for bearing with me.
It's okay. It's good. Good to see that he wants to join in.
He does want to join in. So invitations to screening. One of the things I've experienced, even being a doctor, is when you get the letter, you just become anxious. So you get the pap smear letter, and it tells you that you have to come to the screening, and if you don't come, you'll be taken off. And it feels almost like a personal attack. And there's a realization that the way we understand and perceive healthcare information can affect the way we engage with healthcare. So Health Watch is doing a lot of work to understand how communication can be better. And these are some of the things that we can engage in as a community to improve how we experience healthcare. So I encourage people to check that out and see if they can offer any information that would be of help to the health service. Now, I think for me, this is the most important information from everything that we're going to be talking about today. And this is what I would like people to take away as the most important point. And it's how should we be talking about screening? In subsequent slides, I'll show the age groups for the cancer screening programs in the UK. And I recognize that there'll be people who listen to this talk who are not based in the UK and who don't necessarily have programs in their countries that look after your health in this way. So again, remember that you are your own health advocate. So you can actually go to these screenings according to these timelines wherever you are in the world, and we'll talk about investing in your own health. So I'll come back to the topic of this slide, which I think is what we should take away, and is how should we talk about screening? As a community, we need to have parents asking their children, have you attended your screening? What was the outcome of the screening? We need to have children asking their parents, have you attended your screening? What was the outcome of your screening? We need to have grandparents asking their grandchildren, have you attended screening? What was the outcome? When is your next screening? Have you been invited to another appointment? Would you like me to come with you? These are the questions that we should be asking. Husbands asking wives, wives asking husbands, siblings asking each other, cousins asking each other, friends. You attend your friend's 50th birthday. After the party, you ring them and you say, you're 50 now, you should be getting your breast cancer screening. Have you been? What was the outcome? Religious leaders taking that responsibility in your community to say to your community, I've just had my bowel screening. This was what it felt like. Everybody who's this age, you need to be going to yours. We need to be having these conversations. If we're not pushing each other and encouraging each other and normalizing the fact that screening should be done, then these conversations will not happen, and people will receive these letters, not pay attention, because it's quite easy to put it off. Say, for my life, for example, I'm on call when the letter comes and I'm like, oh, I'll call them in the daytime because I'm away the whole day. I can't ring my GP during the day. I don't have that time. And then I've dropped it. But if there's someone in my life who I've told, my friend, my husband, my sibling, I've told that I got the letter, that person should be asking me, you got that letter the other time, did you book your appointment? Have you booked it? So this is the way we support each other as a community, to make sure that we're doing these things and we're looking after our own health and we're looking after each other, because each person has to be their brother's keeper, sister's keeper. We need to look after each other. People in relationships, everybody just paying attention to each other and each other's health. Family history is something that's important. And in our communities as Caribbeans and Africans, we know that there's a hush-hush culture around health. So what happens is somebody dies of a cancer, for example, and nobody knows it was a cancer because we don't talk about it. You know, there's this whole we don't talk about Bruno kind of thing. We're all quiet about it. If someone dies of a cancer in a family, it has impacts on everybody in that family. And it's important that we talk about these things and we ask questions. We tell each other, this was the type of cancer, this was how old the person was. And that health information becomes available to GPs, whoever is looking after you. And then that person knows if you're at risk. Because there are now these programs in the UK, they're genetic programs where they know that the check boxes, you know, this person was this age at the time they were diagnosed with this cancer, this type of cancer, the cancer had this type of biology, therefore this person's family should be screened. This person's family, the genes are tested. If the gene testing comes out positive, then this person should have this kind of screening starting at this age, continuing until this age. These things are really important. So we need to talk about all of these things together and make sure that we're doing the right things. In the UK, we have different types of screening, population screening. So we pay our taxes. So that means that we get screening covered in the NHS, no additional costs from your pockets, apart from, say, you're missing work or things like that. So population screening is something that can be arranged, that comes through GPs, letters and things like that. And then there's other types of screening, and those are the types of screening where you take responsibility. I'll spend some time talking about prostate cancer and how you take control of your own self. Private facilities, you can pay for your own screening. So if these things are not covered by your GP, then you can take control and pay private facilities and get screened for certain types of problems. So these are the main categories, how you can access screening for yourself in the UK. If you're outside the UK, depending on the setting, you understand your health system, so you arrange for your own screening to be done that way. So I saw a question pop up just now about the ages, and I'm just going to share this pictogram with you. I've taken the bits off, so this is published by the government, and it has all the screenings in the UK, non-cancer as well as cancer. So I've taken screenshots of the cancer ones, since that's what we're talking about today. And we'll start with young women. And the terminology has now changed so that it's not women, but people with a cervix, so that people who don't identify as women who still have a cervix are not left out of the screening program. So anyone with a cervix from the age of 25 up to the age of 49 is screened every 3 years. And that every 3 years is if your smear tests are normal. If the tests are not normal, you may be screened more frequently, or you may be asked to come back for more testing. So it's important when you've done the screening to follow up to see what your results were and what the next steps would be. Again, share the information with your loved ones so that everyone is abreast of what's happening and you can get that support. People can remind you, ask you, support you, attend appointments with you and things like that. Once you hit the age of 50 for cervical screening, because the risk is considered to be less, it then happens every 5 years until you're 64. With breast screening, that's offered to women aged 50 to 70 every 3 years, but a recognition came that if your first invitation happened at the age of 50, then by the time your appointment comes, you might be 53, which means you may have missed an appointment. So in some parts of the country, it now starts at the age of, the invitations start from the age of 47, so that no 50-year-old woman is missed. Bowel cancer screening, the age on this pictogram is 60, but depending on where you are in the country, it might be later, it might be earlier. And with that one, it happens every 2 years. And those aged 70 and over can request screening if they want to, or if their GP is concerned, their GP will refer them for screening. So these are the ages to note for the cancer screening, and these are the ages to note in your own life and in the lives of your loved ones, so that you can check and make sure that these things are happening and people are not missing out their appointments. So we'll now come to prostate cancer, which I've alluded to from the beginning of the presentation. Prostate cancer is not currently part of the cancer screening in the UK, but we know there's research evidence that shows that Black men are 2 to 3 times more likely to be diagnosed with prostate cancer than their non-Black counterparts. That means that in your personal life, you have to advocate for yourself, to ask your GP to screen you if you have any concerns. And some of the reasons why you might have concerns would be if members of your family were diagnosed with prostate cancer, particularly if they were diagnosed at a younger age. So say someone in their 40s, or if they died from the prostate cancer, because cancers, although they are all called cancers, they behave differently depending on the type of cancer, depending on some of the biological characteristics of the cancer. So some are more aggressive, and we know that cancers in young people tend to be more aggressive. So those are some of the reasons why you might ask your GP. If you have any family history of any type of cancer in a mother, a father, a sibling, a first-degree relative like an aunt, communicate with your GP so your GP can take into consideration your risks and organize testing or any genetic information that is needed. Your GP will take control with your help of your health if you're able to provide the right information to them. As a community thinking about prostate cancer, it might be time we start advocating for a screening program for Black men that is sponsored by the government. If we know that, because at present, looking at the entire population, it doesn't make financial sense. And this comes back to what we discussed at the beginning. It doesn't make financial sense because a lot of people who are diagnosed with prostate cancer will not die from it. A lot of people who are diagnosed with prostate cancer will live long, healthy lives with no problems. So the screening program will detect and treat a cancer that wouldn't have caused any trouble when you look at the general population. But when you take away the general population and focus on Black people, that information is not the same. So as a community, it might be time for us to start advocating for a screening program for Black men for prostate cancer. I'll now come to investing in your health. You are your own advocate. No GP, no spouse, no partner, no sibling is going to be able to take more control of your own health than you can. So it's important to be aware of what is important for your health. And this includes health promoting behavior, getting in control of habits like smoking, regulating the amount of alcohol that you're taking in, your weight. These are all things that contribute to the risks of cancer. Knowledge about screening programs, things that we've talked about today. By being here, you're taking control of your own health. So these are things that you should be doing for yourself, for your family, for your community. Financially, looking after your health. So if you feel that you're not getting what you need, the wait times are too long, or you're just not happy with what you're getting on the NHS, it might be worthwhile to consider health insurance, to consider paying for screening programs on your own. Be willing to put your money into looking after yourself, because that's something that's difficult for us. Health is not something that we've traditionally prioritized, we've taken for granted over the years, and we need to start to change our culture around the way we behave with our healthcare. And finally, from the point of view of taking control, presenting early. When we find lumps, when we find bleeding from the back passage, the front passage, when we have these problems, vaginal bleeding after sex, or blood in your stools, or passing blood in your urine, or painful urination, or any of the symptoms that we know that are not normal, you don't have to be a doctor to know your body isn't behaving the way it should, because again, you are the most important advocate of your health. So you know what your normal is. Once there's a deviation from that, you need to talk to a healthcare provider early so that any intervention that can be put in will be put in. Let's stop avoiding and stop procrastinating and stop prioritizing work and everything else ahead of our health. Let's take control of our health and report problems as soon as we notice them. So that brings me to the end of this conversation as I've prepared it for us this morning. I'm happy to take any questions that have come up. Thank you for your time and for being here with me this Saturday morning or with all of us.
Thank you very much, Dr. Ibi. That was a very informative and, again, necessary talk. Really, really, really enjoyed it.
Thank you.
Seems like there's a question that was asked earlier, but you already answered it, I think. It's about what age does bowel cancer screening start? But you answered that really well, 60.
Thank you.
I can't see any more questions. If anyone has any questions, just, type it into the chat for Dr. Ibe. I will have a look and see if anyone has anything. But in the meantime, I have some questions that I'd like to ask, if that's okay.
Yes, that's great. Thank you.
Yeah. So I noticed how you said, we as people, especially Black people, we tend to not talk about these things as much. Why do you think that kind of is, in terms of like what kind of is stopping Black people from talking about screening and cancer?
I think my view, and this is not based on any science at all, this is just based on my experience of life. I think it comes from a culture of just looking after our own selves. So we've always had to, especially coming from my perspective as a Nigerian, you looked after yourself. There was, if you were ill, you had to, you have to, I'm using past tense because I've relocated, but if you're ill, you have to go to the hospital by yourself. There's no screening program. At the best, maybe there's an NGO that is coming around every so often to do something, but your health was your problem. There isn't anyone who's looking after you. So I think that culture just has taken over and you're not communicating. Whereas when I interact with people who are born in the UK, the NHS and the services it provides are part of the culture. So you walk past people in the bus stop and all they're talking about is what happened in the hospital or some hospital appointment they have or what's happening at the GP. So I think it's just the culture, what has always been, and we've just gone on with that. Yeah.
Yeah, it's true. That's I think the one thing that I noticed as well, there's a lot of a sense of like, suffering in silence. You don't want to be a burden on anyone, so you kind of keep it in, keep it quiet. How do you think that we can kind of overcome that kind of, self-reliance to the point that it affects us negatively?
Yeah, I think that was one of the things. That's why I was saying about that slide being the most important one to me that I wanted everyone to go away with. If I want to keep things quiet and I'm not telling people what's going on with me, if people who are close to me know that at this time, you're meant to be doing this, and you ask me a direct question, it becomes more difficult for me not to answer that question because I would then have to lie. And most of the time, we're like not willing to lie. So if you're asking those questions directly, then I think it becomes more difficult to hide and avoid those discussions.
Yeah, that's important.
I've seen a comment. Is it okay if I just address that comment quickly?
Yeah.
Somebody has put in the comment box not to speak negative things into existence. And I want to address that because that's why we're in this community and speaking. The idea that if you talk about your healthcare or screening or anything, then you're attracting negative energy. I don't want to say it's flawed, but it's part of the reason that we're here and we're doing these things. If someone attends screening, it does not mean the person is speaking into existence something negative. It means the person is taking responsibility. If you are, for example, the breadwinner of your family and you refuse to attend screening because you don't want to be found to have cancer, for example, what you're doing is that you are directly, not indirectly, you are directly saying to your family that you don't care what happens to them if you are diagnosed with cancer, because you are not taking responsibility for making sure that if you can have your cancer detected early and treated, it's better for yourself and for everyone. So this responsibility to look after yourself, this responsibility to engage with these programs is not only about you. Your life lost impacts your community, it impacts your nation, it impacts so much. It's not just about you dying. You've had a life, you've been trained, you're educated, you have experiences, you have knowledge, you have a lot to give to the world, your family, your community, the world at large. Your absence in the world is going to make a difference. So if you're not taking responsibility for these things, it means that you're not recognizing your value. And to you, it doesn't matter what happens. So this idea of hiding behind faith and using that as an excuse to avoid taking responsibility, I think we need to address it head on. We can't continue to do that. You attend your screening, and if you want to work with faith, then you attend your screening with faith that your screening will be fine. If you want to pray, when you've been invited back, if there's something found on your screening, then you pray that when you go back to that screening, it will be fine. Those are the ways to apply our faith rather than to avoid attending screenings that would make a difference to our healthcare. I just wanted to address that because I think that's a really key issue in our community.
Yeah, 100%. I agree as well. I totally agree. It's people as well kind of use their fear. They use their faith to cover up their fear when instead of attacking it head on, they just say, "Oh, everything's going to be fine," which, yeah, I totally agree. I think there's a lot more people talking about this, and I think what we're talking about now is a major issue. Ayobo says the culture of "not my portion" is one of the reasons why our people do not come forward for screening in time until their situation gets worse, which I totally agree. Julie asks, how do we get our men and women to get screened?
So you get invited at the ages I showed on the screen. So the GP systems are automated so that people get these, and the screening programs as well. It's a networked, well-oiled machine where it triggers the system triggers these letters and you get your invitation. The reason it's important for us to have this conversation and to know about the ages is if you don't get invited, then you can call and say, I haven't been invited, I'm waiting. And if by some happenstance your letter has been missed, then you can go to attend. You can call them and they will arrange for you to come to your screening program. So once you register with a GP, of course, the problem comes if you're not registered with a GP and you don't have a GP, then that becomes problematic because you need to be registered for this system to work. And encourage each other. So men encourage your women, women encourage your men. Encourage each other to attend, ask questions.
Yeah, I really liked what you said as well before about how, that really important slide when you were saying everyone should be talking about it. I think that makes a massive difference if your closest ones aren't scared to bring up the question, and if people are suffering, they're open about it. It kind of helps other people as well to talk about it and be less scared. There's a question earlier that someone asked about if you have any thoughts on a different recall model that might improve uptake of the invite for screening, and what could we do as healthcare providers beyond speaking about the importance of screening in practical terms?
So in practical terms, as a healthcare provider, I'll start with that. Ask when you take a history from a patient, if they're in the right age group, ask them, have you been to this screening? Have you been to that screening? Some of the times, especially for me as a general surgeon, that's directly relevant to what I do. But I can imagine if you're a GP, if you're an ONG person, when you interact with your patients, ask them about their screening programs. That will form part of your history taking. And that if they don't know about it, sometimes they don't know, sometimes they haven't been, encourage them to go, give them the phone numbers to ring to arrange their screening. I do this in my practice, and I think that's an easy thing to do from that point of view. perspective in terms of the recall. I think so. I put the slide about Health Watch earlier, and I talked about the way we engage with the information. I talked about the way I feel when I receive those letters and what they sound like. If you find that the letter is causing you to be anxious, think about the way you deal with your anxiety and address that anxiety. Personally, when I get anxious about things like that, I pray. Once I've prayed and I've kind of started to make peace with the idea of what I need to do, I'll speak with my family, I'll speak with my friends, speak with people who will encourage me, pray with me. Those are the ways I approach those kind of things from the point of view of someone who is not a person of faith. Understand that this is a response. So we're, as human beings, we have systems that keep us alive. So you have a nervous system, you have your flight or fight response. So there are things, if your body feels attacked by that letter, it inspires those emotions, the anxiety, the fear, the avoidance. So you need to understand yourself and understand that this is happening just because I'm scared, and then deal with that fear and do what you need to do anyway. Because again, remember how important it is for you to stay alive and well for yourself and for the world at large. So those are the ways, those are the things I can think about from that point of view.
Thank you. It's very helpful. What just question, what kind of steps can someone take if they have say a test and they get results back and it's abnormal or something? What's the best immediate steps to take?
So your support system is something that I'm very fortunate. I have an incredible support system in my family and in my friends. Not everyone has got that. There are organizations in the UK where you can call phone lines to talk. I'm trying to think about, I think Mind Talk, I think they're called. I will just try to Google that to make sure I've got it right, and I'll put it in the chat box if I can pull it up quickly enough. So there are organizations you can call just to talk about what's happening if you're feeling overwhelmed. And is it Talk Mind or Mind Talk? I can't remember. Yeah, it's Mind Talk helplines. Mind helplines. So I'm just going to click on that and put that in the chat box. If you're in a faith community and you have people in your faith community that you trust, that's another really useful tool that you can use in times like that. If somebody in your community has shared about an experience, which is one of the reasons why talking is important. If someone in your community has shared that they've had a similar experience, you can reach out to them and see if they're happy to support you. I would not recommend joining support groups online. So say, for example, you've had a recall for following your pap smear. I wouldn't recommend at that stage going to join like a cervical cancer support group on Facebook, for example, because you haven't been diagnosed with cancer and the people in that group are going to be going through a lot of things that you have no idea about that will just cause you to panic. So at the stage at which you get the recall, you need to remember that it can be either outcome when you go back. So it can be that this is all fine, and it can be that this is not fine and there's some extra treatments that you need. So what I always say to my patients at the stage where we're starting that journey of diagnosis is take each day at a time. Don't try to overthink things. Don't think about the extreme. I remember a patient I had who had just a shadow on her pancreas, and we weren't sure what it was. And she was talking to me about pancreatic cancer and what she would do. She was diagnosed, saying she was fine with it. It didn't really matter. And I'm like, listen, I'm not trying to give you false hope, but you do not have pancreatic cancer today. Today, we can see something abnormal, and we need to investigate that. So as much as possible, take each day at a time. When you've been told that there's something abnormal, that's all it is. There's something abnormal, then we need to reassess it. You go for your reassessment. If maybe a further biopsy is done or some more testing is done, you need to wait for more results. That's what it is. You need to wait for more results. So just go to each appointment at each point with the mindset that this is a journey. And if you're coming at it from a place of faith, then you pray. So say, for example, you're at the stage where we're not sure what this is, we need to take some more tissue. Then you pray at that stage that, okay, when they take more tissue, it'll be fine. Okay, so you get there and it's not fine. Then you pray at that stage that it's the simplest, most possible version of what's happening that you're going to have, not the worst possible version. So you keep, if you're using faith, then you keep using your faith in that positive way to hope for the best.
Mm.
But at every point, just take each step at a time and don't go down the deep end. That's how I speak to my patients. That's how I speak with myself. Just take your time, one day at a time. Let's not be panicking and thinking about the worst at this stage.
No, yeah, thank you for that. It was another really brilliant answer. Important not to panic, and as you said, go down the deep end, take one step at a time. That's really important. Thank you. Hazel says that I think as people of faith, those of us who are trained in different health disciplines should encourage our faith leaders to have regular health talks similar to Bible studies or prayer meetings. I think is a really, really good point, to be honest. It gets everyone talking about it and just making it a part of life, not just something that we can brush to the side. I think it's a really important point.
I agree. I agree. There was a question that was asked earlier about the upper limits, why there are upper limits to the screening program. Sorry, excuse me.
Bless you.
Thank you. So there are upper limits again because the screening programs are financed by the government. Excuse me.
Might be those flowers in the back.
Yes. So I think the thing is we need to understand that this is it's management of costs. So that's why there are upper age limits, but the government has made it possible for people to be able to call. So if you feel like actually I'd like to get this screening done, I'm a bit worried, then you can call and book it once you've passed the age limit.
Okay. Thank you. Yeah. Things are saying that there are health drives that do take place within place of worship. So it sounds like different communities and churches also have programs, which is really important. Yeah. Is there any kind of like cancer awareness groups that's run or connected to CAHN Health Network?
I think I'll leave the CAHN team to answer that.
Fair enough. Yeah, fair enough. Do you I noticed you said something about advocating for funding for screening for Black men with prostate cancer. Is there any kind of movement towards that? Or is that just something that is more of a good idea?
No, I think it's a good idea, and from the point of view of community drive. So we've got CAN, people start these petitions all the time, things get debated when they reach a threshold. So it's just that for us to start to, take the initiative about things that we're concerned about to see change happen. Because a lot of the things that happen because people are using their activism to bring about change for better lives, for all of us, really.
No, yeah, I think that's really important. Okay. Toby De Niro raised his hand. Toby, do you have something that you'd like to say? No? Okay. Maybe it was a more of a high five kind of thing. Oh, okay. Yeah. I think it was a really, really important talk. And points about how, because I think, yeah, because cancer can be so scary to
Yeah.
people just avoid it massively. Do you have any kind of case studies in your practice about how, oh, so Toby says he does have a question. Hi, Toby. Oh, he can't unmute yourself. Don't worry, Toby. You can just put it into the chat, and then we'll read it.
Okay, I'll let Toby type, and I think you were finishing a question about a personal experience that might explain why Black people, was that where you were going with that?
So I was going more along the lines like personal experiences or case studies where like early screening has like helped someone or changed someone's life, or kind of like, something was diagnosed earlier or anything like that.
No, I think that's for me that's part of daily life, because in the services where I work, the work that we do, a lot of the work we do is generated from screening.
Mm,
So breast cancers, for example, majority of the operations we will do are screening detected cancers. Um, in colorectal cancer, a lot of people will get their surgeries because a polyp was shown to have cancer in it because they attended their screening. So
early on.
it's I don't do gynecology, so I don't get involved with cervical cancer a lot. But I imagine that a lot of the work that is generated in gynae comes from screening for cervical cancer, because you then get treatments and things and investigations based on that.
Mm. So yeah, so it's just highlights how important it actually is,
Yeah,
because there's probably millions and millions of people who, if they hadn't have gone, it would have just
absolutely.
manifested later along, and it's really something a lot worse. So yeah, it's so so important. But yeah, do you have any personal stories about why you think there's people don't want to talk about cancer or anything like that? I think that might.
Um, I think the fear of it, and then I think again this culture of faith. So for some reason, we've separated our faith from the work that doctors do, and it makes it difficult. So when I was in Nigeria, for example, you'd have people be diagnosed and go off to a prayer camp for 2 months, and something that could have been cured even at the time of diagnosis, the person returns and is dying. So I think it's really important to say that what we do
Mm.
as healthcare professionals is not the healing work. We're in the business of therapy, we treat. So if you're coming at your diagnosis with faith, know that it is God that heals. So I always get very cross when people give testimonies like, oh, what the doctor said, blah, 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 and God has healed it. Like, yeah, the doctor wasn't wrong. God healed you. That's like your diagnosis was your diagnosis. You prayed, you got your healing. It wasn't because the diagnosis was wrong. It's
Mm.
because you've now been healed. So that's way of thinking about things. If you have a diagnosis that needs to be treated, you carry on with your prayers and then go for your treatments, because the two work together. If you hadn't had that diagnosis, you wouldn't have had something to pray about. So the two work together. You have to, we can't keep separating the two, and doctors are the evil people and God is the amazing. It works together. Well, our hands are blessed. We pray. We also pray that God blesses our hands. God uses our hands to bring healing. So it's together. We can't keep separating them.
Yeah, no, 100%. I totally agree as well. We're doing like the like God does the main work, and as you said, yeah, we're part of the therapy team. Um, Iyabo has raised her hand. Iyabo, do you have a question? Oh, sorry. I think we're finishing soon. Um, yeah, Ruth says that June is doing the closing slides, so I think unfortunately we're gonna have to end here, which is sad because it's a very informative talk. I think there's one more question I want to say to Toby. Toby said, "What can someone do if you think you have food poisoning, but you don't want to go to your GP because of trust issues?" June said very rightfully to call 111, and Zana said that the pharmacy is very helpful in that side. You can consult with pharmacists there. I want to say drink plenty of fluids, rest, and give yourself a day or two, and you'll be fine. Please unmute me. How do I unmute Ayabo? Uh, oh, ask to unmute.
Yeah, thank you.
Yeah,
That's
sorry.
been done. Yeah, thank you very much. Thank you, Ibifunke, for this insightful presentation. And I just want to make a contribution. You know, when I did ask about when will bowel cancer screening start, and that was when you put the different times, you know, for the different screening, and that's quite helpful. Thank you for that. Yeah, I had a friend who was less than 60, and she was having stomach ache, and then she would go to her GP and they say, oh, they have checked, there isn't anything. And then she insisted, but they still did not do anything. One day, she had to lie. And while she was in the office, she said she went to toilet, and then she saw urine, you know, she saw blood in her urine. And that was when they called her. And then the doctor started, you know, following her about with phone. And they told her to come for test, screening, and she did. They discovered that she had appendix. And at the same time, they now discovered she had bowel, something in her bowel. And that could have developed into a bowel cancer if that was not detected in time. She's less than 50. She's less than 60. She's 50 something. But what I'm trying to bring out of this is the fact that if you are feeling unwell, you are feeling something, follow it up. And just like it's been highlighted here, that we need to take responsibility for our health, no matter what. We need to take responsibility. And if she had not done that, maybe it could have been something else. She's still not yet, so they had to take the appendix out, and then they work on the bowel, you know, problem. And again, when we talked about the issue of it's not my portion, doctors, whatever they do, whatever their hands, you know, have been able to do, I think it's God that has inspired it. God has given them the wisdom to do it. And when people say, oh, it's not my portion. But the unfortunate thing is that even these pastors that tell you not to go to come and pray for 2 months, they travel, you know, especially from Nigeria. They travel to go and do a medical checkup somewhere else. But you are there because my people perish for lack of knowledge. You are there in the church, staying 2 hours, you know, about 2 days or 20 days to go and pray instead of, you know, seeking medical attention to your problem. So I'm really grateful. Thank you on this platform for all you do, and God will continue to empower you to do it. Thank you.
Thank you.
Thank you so much. Thank you for that contribution. I think you've highlighted something really important that I would like to add quickly, if that's okay. You said that your friend was checked, and that tends to happen a lot. When you go to the doctor, they'll say the doctor checked everything. Please ask what they're checking. Inform yourself to make sure that what they're checking is relevant. So sometimes what is being checked, because again, there might be communication gaps where the person doesn't fully understand the history that you're giving and is not making the right investigations because they don't understand your history or things. So if you have problems, and we have opportunities of access to people in different networks, if you have problems, look up what your problems are, look up what investigations. So NHS has a website called NHS Choices. Let me just double check that as well. And you can look up what investigations you are expected to have, when you should be expected to go to the hospital if you have this problem. And it's no, it's not NHS Choices. NHS information. So it's important. So for example, your friend had that problem. If she didn't have the right tests for the right thing, so say for example, she didn't have her stool tested to see if there was blood in her stool, then she hasn't had the tests for, I don't know what symptoms she presented with. So you need to be aware also of what you should be expecting, so that when people say we've checked everything, you can ask. And when you have tests done, what blood tests did I have done? what were the results of those blood tests. Like, just take control. Don't say the doctor said it's okay. What is okay? What did the doctor say is okay? So you can have conversations that are even meaningful when you're talking to your relatives or friends who are doctors, who can reassure you that actually everything has been done or it hasn't and you need to go back. So that was the important thing you highlighted. Unfortunately, I can't find the website where they talk about it, but there's an NHS website with patient information where you can look up things like this.
Usually, sometimes what I do is, yeah, I'll type in like the issue that or the disease I'm concerned about, and just type in NHS, and then
Okay.
NHS will usually just link you to like a more patient-centered explanation of the disease, which I think is good.
Yeah. I think that would be the way to go. So you're also informed.
Okay. Does anyone else in the audience have any contributions, any final contributions or closing thoughts? Just raise your hands if you'd like to say anything. No? No? Dr. Ibe, do you have anything else you want to add? Or anything that you think that you wanted to expand on? Oh, one more thing. Sorry, before I forget. What is Health Watch?
So Health Watch is just I think it's an effort. So it's an organization and they do, so I'm just going to take the link and put it up. So share your feedback to improve in your community. So they're collecting feedback from people so they can improve the healthcare that is being delivered.
Okay.
I'll put the link in the chat just now. So I think their work is centered around improving healthcare communication, improving healthcare perception and things like that.
Oh, great. Awesome. Like a big research kind of effort. That's really
Yeah. I found them when I was preparing for this as well. So.
Okay. Well, thank you so much for this wonderful, informative talk. Really enjoyed it. And I think everyone else, thank you to everyone else in the audience who have contributed. June, would you like to take over with the closing slides?
Yes, hi. Thank you as well. I'd just like to add my thank you. That was really good. I learned something as well. And you always feel much better when you've come away with some information that's useful. So thank you very much for that.
Thank you.
Can you see my screen, everyone?
Yes. Yeah.
Yes, we can.
Okay, brilliant. Sorry, I've just got it on the slideshow. Right, I will be brief. So I'm just going to talk about what's going on with CAHN, because even when we were doing the presentation, when you're doing the presentation, there was a mention of what CAHN does. We do all sorts. As you know, these are the healthy hours, and during the week, so it's every Saturday morning, 11 till 12:15 normally. I mean, I know today there was an issue, but normally between 11 till 12:15, and these are really essential to our community to learn about our health, because one of the things we've got to do is improve our health literacy so we can empower ourselves to get better, because we don't always have the access we should do to healthcare. So it's up to us listening, hear questions, and even if you want to suggest topics to the CAHN team, that would be useful. But it's just important that we do that as part of looking after ourselves. Okay. Holistic self-care. So that's taking care of your health. On Tuesday, the 4th of June, we have another health program, and that's Tuesday, and it's between 6 and 7:30. So it's on every week, but this week it's about holistic self-care, looking for natural ways to improve your health and well-being. And these are every Tuesday evening. So just listening, you'll learn something. And at the end of the session, they have a physical instructor, Orlando, and he gets you up and moving about. So they really are quite enjoyable and different. You're not just sitting there listening to a presentation. So you have the choice afterwards. So get useful information for the presentation and get up and move. Diabetes peer-to-peer support group. So this I know personally, because this is a group that I run, and we're looking at health literacy, everything we work towards CAHN is improving health literacy and eradicating inequalities. So there's a diabetes peer-to-peer support group which is in North Manchester, and it's run twice a month. And we meet with diabetics. So I'll share my experience, they'll share their experience, and then bringing in different things, different topics, and so we can explain different things. Last week we spoke about traffic light systems because a lot of people don't understand it in our community. So we talk everything around diabetes. So it's to help people become more confident, talk to their peers, share information, get information, so that they can gain control of their symptoms, manage their condition better. And eventually, we're going to get in dietitians and specialists and nutritionists so they can manage their condition, because that's what it's all about, is looking after ourselves. So please feel free, if you live in those areas, just contact us and we'll be able to join you up to the meetings. Windrush Day. All we need is the sunshine, but even without the sunshine, we'll manage Windrush Day. So we've been doing Windrush Day since I think 2017, and I was at the first one. So I've just seen them get better every year. This year it's it's on Saturday, the 22nd of June, and it's between 12 and 6 o'clock at Alexandra Park. And it's really, really interesting, and it's fun, and it's lively, and there's food, dance, and costume. And there's Caribbean old time and contemporary music. And there's a Caribbean living room, which was really, really interesting. When they did it last year, it brought back lots of memories, because when a lot of Caribbeans first came to England, their living rooms they had these rooms which were sacred. So even as kids, we couldn't go in the front room. And they're nearly all set out the same. It just really fascinated me, because as you're looking around, you're looking at things going, I remember this, I remember that. So if you want to register for tickets, you contact Windrush at CAHN, and they've got different stalls. So if anybody's interested in being there, then please join. I can't promise the weather, but you will have an informative day and just fun. And they're usually so chilled and just quite relaxed, and everybody just learns things, and it's nice just to be together as a community. And as usual, we'll be there screening health, doing blood pressures and health screening. So come talk to me if you want to. Okay, so the Black Healthcare Awards 2024, and they will be 27th of July. They will be that will be in London. But we're looking for you to nominate your healthcare hero for an award today. These awards focus on Black people who are descendants of the Caribbean and the African diaspora. So we need you to, people who you think of a healthcare hero. And you know what? There's lots of us out there doing lots of stuff, and it's nice to be recognized, just given, a bit of that you're doing okay, a bit of pat on the back. So anybody you can think of, make sure you nominate them about anything they've done. They've come across, they've helped you, they've helped people. Let's, what say, blow our own trumpet. Let's big ourselves up, because this is what it's about. We're an amazing community, but we need to understand that too, and share it, and just support each other as we're doing. Okay, another one close to heart, Caribbean and African Cultural Wellbeing Hub. So from knowing to action. So we're looking at the launch event is going to be on Friday, the 7th of June, and it's going to be at Gorton Monastery in Manchester. And it's from knowing to action. So providing wraparound perinatal, infant, mental health support for Black women and across Greater Manchester. This is a huge topic. And this is also something that we need to help ourselves, help each other, give each other support. This is another huge taboo subject. People think that when you have a baby, that's it, you should be happy, da. So what does the mother then do when she's having issues, when she's not feeling right? And it's not through her own fault. So there's nothing about, sometimes praying can help, but sometimes you need a bit more help. So it's just about giving us the information that we need to support ourselves, support our mums, young mums, during this phase of their lives, for themselves and their babies. Okay. Thank you for joining us today. And we hope to see you all next week. Put the word out, get more people to come and listen to us, and hopefully we'll have less technical issues next week, and we'll be able to share more information with everybody. Thank you very much.